cluster for mechanical neck pain that benefit from thoracic manipulation. Number 1, symptoms lasting less than 30 days. Number 2, no symptoms distal to the shoulder. Number 3, fear avoidance belief questionnaire physical activity score less than 12 out of 24. Number 4, looking up doesn't aggravate symptoms. Number 5, diminished upper T-spine kyphosis. Number 6, cervical extension range of motion less than 30 degrees. Can you look up for me? All right, and then back down. Test item cluster for full thickness rotator cuff tear and subacromial impingement. The 3 tests for the full thickness rotator cuff tear are, number 1 being the drop arm sign. So bring your arm up. All right, can you lower slowly? Good. And the second test is painful arc. So raise your arm up. Any pain?
No.
And then the third test is infraspinatus muscle test. Arm to your side. All right, now don't let me push you in. Hold. Good. The 3 tests for subacromial impingement are painful arc sign and infraspinatus muscle test, which were previously demonstrated. And then the third one out of this cluster is the Hawkins-Kennedy impingement sign. So I'll bring your arm up. All right. Any pain?
No.
Test item cluster for mechanical neck pain that benefit from cervical manipulation. Number 1, symptoms lasting less than 38 days. Number 2, expectation that manipulation will help. Number 3, pain with posterior to anterior testing of the mid-cervical spine. Any pain?
No.
And number 4, cervical range of motion rotation difference of 10 degrees or more. Can you look to the left? All right, straight, and then to your right, and straight. Test item cluster for cervical radiculopathy. Number 1 is upper limb tension test for median nerve bias. And to make this test more sensitive, I would have the patient laterally flex their head to the right. Perfect. Number 2, distraction test. And then number 3 is Sperling's test. Can you laterally bend your head to the left? All right, and then apply some pressure. All right, and then laterally bend, rotate, and extend. Good. All right, and then number 4 would be less than 60 degrees of ipsilateral cervical rotation. All right, can you rotate your head to the left? And then back to center. Upper limb tension test B, radial nerve. And to make this test more sensitive, I would have the patient laterally bend to the right. Can you bend your head? Good. I'm going to differentiate between a rotator cuff tear, shoulder impingement versus a C5 or C6 cervical radiculopathy. So with a cervical radiculopathy of the C5 or C6 level, I would expect a patient to have impaired sensation along the C5 or C6 dermatome. So C5 and then C6 dermatome. I'd also expect a diminished biceps reflex and a brachial radialis reflex. Okay, so we'll test the bicep. And then no reflex there, and then the brachial radialis. And then no reflex there. A C5, C6 radiculopathy is also associated with weakness in the shoulder abduction, elbow flexion, and wrist extension. So I would test the strength in those areas. All right, can you raise your arm out? All right, I'm going to apply resistance. Hold against it. Hold, hold, hold. Weakness there. And then can you flex your elbow? All right, I'm going to try to pull you down. Pull it up, okay? Hold, 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 hold. And then wrist extension. Can you raise your hand up? All right, don't let me push you down. Hold, 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 hold. And weakness in all 3 of those. Also, a patient would be positive for the test item cluster for cervical radiculopathy. So that includes the upper limb tension test of the median nerve, the Sperling's test, distraction test, and less than 60 degrees of the same side cervical rotation, which all were demonstrated earlier. So if a patient had positive or decreased reflexes or sensation in those dermatome myotone levels and tested positive for the cervical radiculopathy test item cluster, I would rule in a cervical radiculopathy at C5, C6. But if a patient had, weakness in shoulder abduction and strength in biceps and wrist extension, then I would start to gear towards the test item cluster for the rotator cuff tear, which includes drop arm sign, infraspinatus muscle test, or painful arc. Or if I was thinking more of an impingement, I could do the Hawkins-Kennedy impingement sign, the infraspinatus muscle test, or a positive or a painful arc. And if a patient also didn't have reflex impairments, I would also lean towards more of the shoulder, rotator cuff, or impingement problem. Sulcus sign. Okay, just rest your arm there. I'm just going to pull down your arm. I'm just going to check things. Okay. Near's impingement sign. All right, I'm going to bring your arm up. Any pain? No. Okay. Sharp purser test. All right. I'm going to put your forehead in my elbow crease, okay? I'm just going to find your spine. All right, you're going to feel a little bit of pressure on your forehead, okay? Okay. Any pain with that? Nope. Active compression test of O'Brien. Can I have you raise your arm up? And then turn your palm up. All right, hold against it. Hold, hold, hold. Okay, and palm up. And hold against it. Hold, hold, hold.